All right, welcome. We're diving into one of the most critical skills in trauma care, and it's not a technical one. We're pulling directly from Chapter 20 of the ATLS manual to break down how you deliver life-altering news when the pressure is on. You know, this is probably one of the toughest, most challenging conversations you will ever have in your career. And think about it, just like a clinical resuscitation where every single second counts and every move is deliberate, this requires a clear, systematic approach. It has to be done with compassion, for sure, but also with precision. Exactly. You can't just wing it. In ATLS, we have the XABCDE algorithm to bring order to chaos and save a life, right? Well, we have to apply that same level of serious preparation when we talk to patients and their families. It's not something you improvise. So let's break down that process, starting with the very first phase. Okay, phase 1, preparation. And this is key. The process starts long before you even think about walking into that family room. Honestly, getting this right is all about the prep work you do beforehand. It's non-negotiable. So before you say a single word to the family, you have to formulate your core message. We call this the headline statement. It's an incredibly powerful tool because it forces you to boil down a really complex situation into two simple parts: the critical medical fact and what that fact actually means for the patient, right here, right now. Let's look at an example. For a patient with a high-level cervical spine injury, the fact is the spinal cord injury. But what's the meaning? The meaning is that it's interfering with her breathing and we have to intervene. We have to intubate. See how clear that is? It's direct, it's understandable, and it's completely free of medical jargon. This is what we're aiming for. Now, beyond just crafting the message, you've got to prepare the environment and the whole team. I want you to think of it like a pre-briefing huddle, but for communication. You just run through this checklist. What exactly is our message? Where are we going to talk? And who needs to be in that room? And listen, this is crucial. If you need an interpreter, it must be a professional, never a family member. Then how will we deliver it? And what's our goal for the meeting? Getting the team aligned on these points is absolutely essential. Okay, so your prep work is done. Let's move into the room and talk about the conversation itself. Once you're prepared, you need a framework to guide you through this really high-stakes meeting. And just like in our clinical work, we've got a handy mnemonic to help us out. This is our communication ABCDEs. It's your roadmap for the conversation. It makes sure you start by acquainting yourself and then asking what they already know. You have to listen first. Then you give a warning, deliver that clear headline, and then you use silence. We'll get to that. Finally, you encourage emotion and end with a clear plan. It's a structure that builds an empathy. Let's really focus on B for a second. Begin with a warning. This is such a critical step. A simple phrase like, "I have some serious news to share," acts as a warning shot. It signals a major shift in the conversation and gives that person just a brief moment to brace themselves for what's about to come. And now for D, do use silence. After you deliver your headline, the single most important thing you can do is stop talking. Just pause for 10 to 15 seconds. Now, I know that is going to feel like an absolute eternity, but it's vital. You have to give the family that space to even begin to process the information. Resist every urge to fill that silence. Let them be the first to speak. So you've had the conversation, and you might think the hardest part is over. But the work is not done when you step out of that room. The final, and I mean critical, phase of this whole process is the debrief with your own team. This is just as important as the conversation itself. And that debrief actually has two parts that are equally important. First, there's the process debrief. This is all about continuity of care. What did we say? Who's the decision maker? What's the plan? This is essential for handoffs. But the second part is the emotional debrief for the team. This work takes a real toll, and acknowledging how it affected everyone is absolutely key to preventing burnout and keeping your team ready for the next one. So why does this matter so much? Well, a good debrief makes sure everyone is on the same page about the patient's care. But just as importantly, it supports the human beings who are providing that care. It creates a safe space to process some really difficult emotions, and that ultimately builds a stronger, more resilient, and more effective team for the next patient who comes through those doors. So, we've walked through all three phases: preparation, the conversation, and the debrief. What's the big takeaway here? What's the fundamental shift in thinking that we all need to make? This is it, right here. For way too long, this has been called a soft skill. There is nothing soft about it. This is a core clinical procedure. Approaching these conversations with a structured, repeatable, compassionate plan is just as vital to good patient outcomes as any intervention you perform in the trauma bay.
Look, this framework, it gives you the system. It gives you the science and the structure for what is a profoundly difficult task. But the real challenge, the art of it, that's on you. Your job is to take this system and infuse it with the empathy, the compassion, and the humanity that every single patient and their family deserves in their darkest moments.